needs it. And what is the goal of a family of rehabilitation? The goal should not be that the child gets better and better with some kind of a task, or can walk longer, or can start running from getting out of the wheelchair. That's not the goal of rehabilitation. The goal can be very individual. So at first, as a family, I would always recommend to think, what do we need as a family? Like, what are our hobbies? What is the hobby of my child? What does my child want? What do I want? What does the school need? What does the kindergarten need of my child? What does my child need to be in the kindergarten to be integrated in it? So, for example, when you get to kindergarten, it's important to be able to sit on a table together with different children, to be integrated into the community. Then it gets important that a child can eat by itself. Then it needs to be important, how can it like cut things? How can it eat by itself? How can it drink by itself? And then when it gets bigger, it might be important how to drive a bicycle or a tricycle or some kind of other means of transport, so that it can hold up with the other children. So there will always be different topics in life that you have to focus on. I think I will skip that because that's more for therapists relevant. So, and I talked about the goals already, so you see in every stage of life, what is my goal for therapy? It's not only when you go for reha in the clinic, but also when you go at home to therapy, to some kind of practice. So we always say you shouldn't have too many goals at once, maybe up to 3, we usually say in our clinic. And then you set up with your therapist and your doctor, what do we need to reach the goal? Do I need therapy? Do I need some medical intervention? Do I need some medication? Do I need surgery? Or do I just need different therapies? And then what kind of therapies? And then it's important to understand you cannot reach the goal with one snap of the finger, so you go step by step. And usually we need therapy, so that's what it's all about. And the modern approach of therapy is not so much functional like 20, 30 years ago, and I think in the Eastern countries, in Russia, it's very functional, very strict. It's like running a marathon and then you have like a trainings plan. And we don't do it like that. We look for what is my goal, what is the activity, and then we train on the activity. It helps much more so that the children are more motivated, that they actually feel like doing it. And so you have much higher motivation of the child and also much higher success, because you train exactly what you want to do and you don't train something else in order to reach something else. So that's very important to understand, I think, also for therapists, because usually they know both approaches, and parents are sometimes very strict and say, no, we have to be better and we have to train more. And usually more is not better, but very focused on the activity that the child is actually interested in. Yeah. And who is belonging to the team? So I talk of a very privileged perspective of a German hospital that is focused on rehabilitation. But I think a team you can find everywhere in the world, because every discipline will be always existent in almost every country. You will find people, but it's very hard to get them all on the same, like a round table, to actually be a team and be together in a team. And I think that's the challenge in a lot of countries, also in Germany. It's not like that in every hospital. So also when you live at home and you go to kindergarten, you can find up a team. And I just talked to one of your colleagues, and I think it's important to talk with your pediatrician, with your doctor. How can I find my team? And how can I find all these different therapists? Because it really takes a village. It doesn't make sense only to do physiotherapy. You will also need something for the mind and the brain and the behavior. So you will need music therapy or psychologists. And then you can try yourself as parents and try and connect and maybe take one of the hours that are usually paid for training with the child to sit together with the team and say, what are we actually doing here? What is our goal? Do we have success or not, or do we have to change something? And first you need some kind of doctor that you actually trust, so it can be your normal pediatrician, but usually we recommend neuropediatricians that are pediatric doctors for children that are specialized like problems with brain, behavior, motor functions. And they will find a diagnosis of your child. I think yesterday was talked about how to make a diagnosis of autism, of ADHD, of other diseases. It's not that easy. You usually need a doctor that's actually specialist in this and a psychologist. Then you find what is my diagnosis, and then the doctor should help you set up a treatment plan. What is actually needed, how often? Because you as parents, I think it's hard to decide, does my child need therapy 5 times a week or once a week, or what do we actually do? And in the physiotherapy, it's all about movement, but it's also about perception. Where am I in the room? How can I move? How can I play? And also they are responsible for implement tools like wheelchairs and walking aids. For example, sitting at a normal stool, it's not possible for every child. I think you know it all. So there's like therapy chairs, and they have to be modified to your child. And they can be usually rolled around to transport the child inside the room. It can be inside the hospital, but also inside home and also inside a kindergarten. So sometimes it's important to have the device twice, and I know it's expensive, but in Germany it's also always discussion with insurance. If you say, my child is 50% of the week it's in kindergarten, it needs to be able to sit there comfortably, but it also has to be able to sit at home comfortably, to eat and play. And you really have to see with your physiotherapist what kind of device can be used. And sometimes devices can be very expensive, like special wheelchairs or wheelchairs that are like with electronic control that give you more power to reach like more distant goals. But then you can always discuss with insurances. And I think it's also important to realize children grow, so you need stuff all the time new, right? Because they change their pattern of movement, but also they change their height. And then people give back their very expensive tools. And then you can try and find like a pool of like second-hand market that actually exists in Germany as well, or see with insurance if you can buy used tools or just borrow them from your therapist or from a clinic, and then you give it back once you need something else. So you try to make it more affordable and reachable for everyone. And then there's ergotherapy, which is all about using the hands in adults, but in children, ergotherapy is much more. It's like how to sit still, how to concentrate. It's also part of ergotherapy. It's a lot of behavioral therapy. And it's being all about calm, finding your calmness, finding a peaceful moment to play with the children. It's very important that the parents participate in ergotherapy, of my opinion. Not maybe all the time, not every week, but from time to time, I think you as parents should be there to actually watch how your child can be with someone else, because children behave very differently when they are with therapists than with adults, with their own parents. And then you see how can I find, especially with autistic children, they need a lot of structure, a lot of rules so that they feel safe in the room, what they are doing. And if they have a table where they sit optimally, where they can concentrate, not too much offer, like so that they can choose maybe between 1-2 options, and then you get them options to play or options how to do some activities of daily life. But they need a lot of rules and structure, and in a very nice surrounding, so that they feel supported. And that's also a big part of ergotherapy. And I think if the parents actually watch and collect some tips and inspiration how to be with the child at home. I think parents should never be therapists. They should not be the therapists of their child. Also, if you lack a therapist, you shouldn't say, okay, then I'm doing it all myself. That's not what we recommend, because you're the mother or the father or the aunt or a friend, and you should have a different role, but you should support your child. You should not be their doctor. So it's important to get inspired. What can I do with my child, so that the child and I at home have like a happy moment that we share together, to support it with his development, but not take over the role of the therapist. And in ergotherapy, it's also about tools and devices. Sometimes if they want to cut a schnitzel, it's a very common goal of children in Bavaria and Germany. Maybe, I don't know what they want to cut in Romania, but sometimes, or they want to put Nutella on a bread or something. Very common thing that children ask what they want to do themselves. And sometimes it's easier if they have like a special fork or a special plate that is not slippery on the table. And sometimes there are some easy and very cheap tools how you can make these tasks easier for children. And that's also all in the part of ergotherapy. Then there's logopedic therapy. And logopedic therapy, I think we as adults know, is like speech therapy when the child can't pronounce the S or some letter. But it's also about communication. And sometimes it really depends on also children with autism or different behavioral disorders. They have problems with verbal communication sometimes. It really depends on the child. Then we have to find ways of non-verbal communication. A lot is like with gestures and supported, like with different signs that the children can learn, but also the parents then need them to learn. So not the child needs to go to logopedic therapy, but the parents should be there as well to find a measure, how can I communicate with my child with gestures, or with playing cards, or with emoji cards, or with whatever signs, and usually the children, they get some kind of book that they have with them, and then they can show people that they get in interaction with how they can communicate, and they can point to what they want. It's very nice. And if all that's not possible and the child has a more severe disability, then we use media tools. Then we use some kind of tablets that can be directed with the eye or with some kind of tool like this, to let the tablet speak for you. And that also works. So it's important to always look further, like get inspired if it's like regular therapy is not useful or not successful, to get inspired what else is there in the world. And then sometimes maybe you can order it online from another country and see with your therapists how you can use it together. And logopedic therapy is also for swallowing and eating, but I think that's more for the children that are more severely sick and not only with smaller problems. And what I like very much is music therapy, and I talked to Claudia before, it's very hard to be accredited as a music therapist by an insurance. So sometimes probably you don't look for music therapy, maybe you look for a music school for someone who is inspired to work with children. And with music, often some things can be expressed, what can't be expressed with words, very important for children with autism. And these children with special needs, they experience a lot of difficulties in life, and sometimes they have to process things for themselves, and maybe they don't want to talk, or it's hard for them. So it's also good for processing and finding resilience in music. It's also very nice for children that have problems with interaction or communication with other children, because in music therapy groups they can get into very nice interaction very easily and feel like a sense of community. Also, the parents can be there as well. It's very nice if children and parents find a way how to communicate with each other, and sometimes that's with music. Then a very big part, more in the hospital sector, is the social works or social pedagogues. So they can help you find the team. They can help, okay, this is recommended by your doctor, where can I find it? What kind of people can I go to? What kind of kindergarten can my child go? Maybe you make the experience, you send your child to a regular kindergarten, then it's devastating because the child cannot integrate into the group, it's too loud, or it doesn't talk, or it doesn't want to sleep, and it's very complicated. Or it needs a lot of therapists. So it's important to see what kind of kindergarten or school can I go to. In Germany, it's always divided between inclusion, so you go with the child with special needs goes to a regular school and then is included, or they go to a kind of special school. It's always divided opinions, what is better. I think in the end you have to decide for yourself, but it's important that the child has a good place and someone that accompanies them when they go to a regular school. And that's also hard to organize. So social work is kind of responsible to help you to organize all of that. And I'm a big fan of if the child needs a lot of different tasks and therapists, and that you as parents, you drive them around every afternoon, first to physio, then to logo, then to whatever kind of therapy, and it's very exhausting for the whole family system. So it's nice if you can try and integrate it in kindergarten or school. So maybe you can talk to your therapist. In Germany, it's also very individual. It doesn't come by its own, and then you ask them if they can imagine coming to a kindergarten, and if it's maybe a kindergarten that has more children with special needs, maybe the ergotherapist can come one or twice and make all the hours with the children that are there, or maybe on a Tuesday and on a Thursday, and then you as parents don't have to drive around, first to kindergarten, then to therapy, then to the doctor, then to afternoon football class, whatever, and then you're very busy. So you try also for the child to make it not so many transfers, not so many ways, but integrate it into kind of a school day or a kindergarten day. Social work can also be like a person you can talk to if you have problems with taking over of costs, because everything in medicine is expensive. Also in Germany, it's expensive in discussion with healthcare providers, but I think in Romania it's a bigger topic. And here's also health insurance, which should be responsible for taking over costs, but probably you have to have a discussion. Will they pay for this more special wheelchair that we want to have, or will they not? And this you can also always ask a social worker how you can organize it. And the workers are also there for counseling of parents that have like severe psychological stress because of the situation, but also for the children, because the children should not be forgotten. It's not all about, sometimes only the parents are talking, but the older the children get, they also have a voice, what they want and what they need. And they can ask for their own future when it's about transitioning to adulthood, and they want to find their place in society in some kind of job, or what can I learn. it's also, at least in Germany, it's a big task of social workers for the counseling, what is possible for them. And then what's very important is orthopedic technicians. So the people that actually build and counsel you with all the devices and tools that makes life easier when you have a special need. So the special need can be only in the mind, but in the children that I know, it's usually combined. And you have some problem with walking, or one side of your body after a stroke is paralyzed, and then maybe the child wants to play football, and then it's always hard to play because one foot is kind of limp, and then there's a lot of devices that you can use. And your physiotherapist should be your number one person to ask, like, what tools can I use? But you can also go to these stores where they sell that stuff, and then your doctor should write a kind of prescription for that so that the insurance can cover all these devices. And there's a lot of different devices that you can use, very big world. You can always go to the internet, use maybe Facebook forums, like groups with people that have similar children to yours and have similar struggles maybe in life, and exchange each other what is there, and get creative and ask orthopedic technicians, because they are usually very creative people and can build something individual with you. And it's always important, I think, to anticipate early, like, will the disease of my child get more severe in the end, or will it be stable? And a lot of parents are very afraid of wheelchairs. They say then, oh, my child looks very disabled in a wheelchair, it's like giving up on walking, but it's not. Like, we know a lot of people in wheelchairs that are always sitting there, but sometimes a child can need a wheelchair just for longer distances. So they can walk maybe 100, 200, 500 meters, but then they get tired. And then it's very stressful for them, and then they are not independent. And if you want your child, the older it gets, to get more independent, it's very important to give them more tools than you would think that you need, and then to make the child as independent as possible. And I think that's very important. And then you have to find the fitting tool, not alone, but together with your doctor and your therapists. And then I'll talk very briefly, I think, only about medical interventions that also belong to the team as a medical doctor. So for especially some kind of movement problems, there are some medications that you can use for spasticity. You can use Botox. I googled it. It's also available in Romania. I think people know it only from cosmetic reasons. At least before I did this, I thought it was something cosmetic, but you can use it for overactive, like contract muscles, to relax them, to prevent contractures of the children. And it's a very safe method. And I think a lot of people are afraid of them, but I really recommend them to look at it with your doctor if this is an option, if your child has some kind of cerebral palsy or some kind of spasticity of the muscles. There are also some surgeries, but these are all topics to go through with your doctor. So I'm already at the end of my slides, and these are the most important take-home messages for you. So I think reha and therapy is a very individual process, should not be the same for everyone, and should be adapted to the child and to the stage of the life. And what I really want to stress, that therapy is a multidisciplinary, multi-professional approach. And I think that's kind of a more modern concept, and it's really different in all the countries. But I think it can be used in every country with a lot of work and engagement, we say, so that the therapists really come together and think together, what can we do? And there has to be a regular exchange and evaluation within the team, so that not in the beginning you set a goal and then everyone works and you don't get like a feedback loop, what is actually happening. And it can be in the hospital, like in rehab clinics. And I heard from Roxana that there is, for example, some autism rehab clinic in Romania. But it can be also outpatient. So when you live at home in your daily life, you have to find like a therapy network. And I think it's very important not to have too many. So not too many hours, so that you don't overwhelm the child. That the children are always tired, almost sleeping in the afternoon therapies. And more is not always better. Usually, less is more with therapy, because the brain is a very complex thing, and it has to integrate all the information. So the child should sleep enough, should have enough breaks, and when the child doesn't feel like doing something, sometimes it's good to have a break. So find a good network, but don't overwhelm the child. And also at home, you can make some kind of intensive care rehab block, maybe for 3-4 weeks, where you do a lot of therapy, and then you make a break with therapy for half a year. And that's also possible. And then it's it's almost the same point that you should always focus on the life of you and your child as a family and not on therapy. Therapy is not life. Therapy is there to make life easier and more enjoyable for everyone, but it should not be the center of the attention. And with these rehab clinics, we try to lessen the burden of therapies and treatment on the families and try to take over the stress so that we do it like as an intensive block so that you can relax the rest of the year, so that you don't do like 3, 4, 5 therapies a week at home. So that's, I think, good to focus on some weeks and then also find weeks of breaks. Yeah. And I'm already at my last slide, but what I wanted to talk about is like the clinic that I worked before is in Germany, in Bavaria. It's called Vogtereuth. Maybe Claudia will tell you something in Romanian about it afterwards. And it has also an international sector, so I do not want to make any advertisement. I don't even work there anymore, but it's possible for people from abroad that actually come. So we had there patients from Saudi Arabia, we had patients from Croatia, from Slovakia, that try to get, I don't know, inspiration or come there once a year. And you have to pay it probably, but you have to see with your insurance. But I think it's always possible to look with some kind of funding event, is it possible or not? And from neighboring countries or Austria and also Croatia, sometimes it's possible when you explain to your health insurance, like our doctor recommends this and there is no such clinic in my country or in my area. Can we go to another country? And also I know that in Slovakia there are 1-2 very good, and it's not that far like Germany from here, or also in Hungary, there are clinics like this, and then you can see with your insurance, is it possible maybe to go abroad? I know then it's very complex to organize with your family system. You have siblings at home, then you go to Germany for stupid rehabilitation. It seems kind of crazy. But I think it's okay to look above, like what is your limit maybe here, or what can you do, what can you get creative with your own system that you have and use it here, or you don't find anything and your child has a very special task to learn and then you go somewhere else. I think that's also possible. And yesterday I said it as well, if there are therapists listening, they can also come and like do a hospitation, like a practicum, and maybe look what is going on there, what can we take over, what can they bring in as an input, and what can they take out as an input for going back to Romania. So I think it's worth thinking about it. Yeah. Thank you very much for the attention.